Hi, Miss Poppy. My name is Gina, and I'm going to be your nurse practitioner student for the day. What are we seeing you for today?
I'm really having a lot of stomach pain.
Okay, where exactly is that pain at?
Notice it's like right here,
Okay,
right like under where my lungs and stuff are.
okay. When did that start?
Um, this time around it's probably been going on a couple days.
Okay. This time around, so have you had problems like this in the past?
Yeah, it comes on every few months or so.
Okay. So explain that pain to me. Is it crampy? Is it dull? Is it aching? How does it feel?
It's like a sharp ache, almost like there's a knife in there that somebody's twisting.
Okay. So is there pain there all the time, or does it kind of come and go intermittently?
When it comes on, it's usually there all the time.
Okay. So how would you rate it on a scale of 0 to 10?
Right now, it's probably like a 6 out of 10.
Okay. Does it radiate anywhere?
No, not usually. It just stays in that one spot.
Okay. What have you tried for it at home? Have you tried anything for pain or to?
I might take some ibuprofen once in a while for pain. I don't really try. I don't really like taking stuff, so I just take ibuprofen if I have pain.
Okay. So with that pain, are you having any other symptoms? Do you have diarrhea or constipation or nausea and vomiting? Anything else?
I have noticed I've had a lot more diarrhea in the last couple days.
Okay. How many times a day are you going?
Like 6.
Okay. Have you noticed any blood in your stool at all?
I don't think so.
Okay. So have you tried anything? Have you noticed anything that maybe makes it better, or maybe activities or something that you've eaten that makes it worse?
I've noticed, if I eat McDonald's and Chinese and stuff like that, that really makes it hurt a lot worse.
Okay. How about the loose stools? Is it more so after you eat, or is it a certain time of day?
Usually like every time I eat, I have to go to the bathroom right after I eat.
Okay. How about any cold-like symptoms? Any headaches, sore throat, fevers, chills? Do you have any kind of those symptoms?
No, I haven't noticed any.
Okay. And how have you been eating and drinking? Are you being able to take in enough fluids and be able to eat okay, other than the fact that once you eat you have a loose stool? Or has your appetite been down?
No, my appetite's about the same. Drinking, I think I drink enough.
Okay. How about have you noticed any masses anywhere? Maybe some swollen lymph nodes? Any rashes anywhere?
No.
Okay.
Mm-mm.
How about, when was your last menstrual cycle?
I'm pretty irregular, so it's probably been a few months.
Okay. Any recent changes at all when you have your menstrual cycle? Is there any more pain or any increased bleeding, or is it usually pretty about the same?
It's the same all the time.
Okay. How about any urinary problems? Have you had any frequency, any burning? You notice any blood in your urine?
No blood. If I drink more fluids than I pee, then I seem to go pee a lot more.
Okay. It doesn't burn at all when you go?
No, not that I've noticed.
Okay. Have you been around anybody recently that's been sick? Had any stomach issues?
No, I don't think so.
Okay. So let's talk about your history a little bit. Have you ever had gallstones or kidney stones or urinary tract infections?
I think they said I had gallstones one time. I had a lot of severe back pain, and I went to the ER and they did this scan on me. And I think that's what they diagnosed me with. They gave me some morphine, and then it kind of went away, and they told me to avoid some certain foods, and I haven't had a bout of that since.
Okay. Have you ever had any imaging done, like maybe an endoscopy where they go in your throat and look in your stomach, or a colonoscopy to check in any of that stuff?
No.
No? Okay. Is there any chance you're pregnant? I know you said it was a couple months since your last menstrual cycle.
No.
Okay. And are you currently sexually active?
Yeah, but I have same-sex partners.
Okay. But are there any chances of STDs at all?
No.
Okay. Is that something you'd be interested in testing while you're here today?
No.
Okay. Have you had any surgeries in the past?
I've had one surgery. I had some cysts on an ovary. That's all I've had.
Okay. And how long ago was that?
Oh, I think it's been about 3 years ago.
Okay. And do you know what side that cyst was on?
It was on the right side.
So does your pain seem to be similar to that you're having in your abdomen as when you had that cyst on your ovary, or does it completely different?
This one seems higher.
Okay. All right. Have you had any hospitalizations recently?
Nope.
Okay. How about your immunizations? Are they all up to date?
Yes.
Okay, good. Do you know if you've had any illnesses during your childhood, like measles, mumps, chickenpox, anything like that?
I had chickenpox when I was 5.
Okay, and no complications from that
Nope.
that you know of. Do you take any medications at all?
I take one for anxiety, and then one for I have hypothyroidism.
Okay. Do you take any herbal supplements or any over-the-counter medications?
No.
Okay. How about any allergies? Medications, foods, environmental,
No.
anything? Okay. Any recent travel?
No, I'm kind of a homebody. I like to just stay in town.
Okay, that sounds good. How about any recent changes in your diet? I know you said your intake's good, but have you recently maybe started a new diet or tried a different kinds of food?
No, I'm kind of on the go a lot, so I end up eating a lot of fast food.
Okay. And that's kind of how you've been a lot? That's not new for you?
No.
Okay. Do you smoke?
No.
Do you drink alcohol?
Oh, I drink socially.
Okay. How often is that?
Oh, I might go out with friends on a Saturday night and have maybe 3 or 4 drinks.
Okay. All right. Have you ever used any illegal drugs, or are you currently using any?
No, I don't understand people's fascination with those.
Okay. What do you do for a living?
Currently, I'm going to school, and I hope to be a kindergarten teacher when I'm done.
Okay. All right. So, do you have any? Does any of your family members have any medical history, like diabetes or heart disease or any cancers at all?
Yes. My mom had both diabetes and cancer, and then like my aunts and uncles, they all have diabetes too.
Okay, sounds good. How about, does anybody have any neurological problems, strokes, seizures, anything like that?
I think my grandma's had a stroke before, but nothing that she's had any like deficits from.
Okay. Has any of your family had issues with their stomach or intestines or anything like that you can think of?
Not that anybody's ever voiced that they've had troubles. No.
Okay. Is there any other history that anybody has that you think that I should be aware of?
Nope, I think we covered it all.
Okay. All right, well, I'm going to have you hop up on my table and we'll do an exam of your stomach here.